Welcome, fellow nurse. Sarah here, your colleague on Global Nurse Network. Let's be real, your shift is packed before you even clock in. I've been where you are, 3 patients on a med-surg floor, a fresh admitted 0530, and a family waiting for answers that aren't in the chart yet. You know what's even worse than the workload? The feeling of losing the patient in a sea of screen time. Worse still, when tech makes things slower, not safer. That's the thing about nursing informatics, it's not just about clicking faster. It's about using digital tools to see the person again, to catch a subtle change in vitals before it becomes an emergency, to free up time for rounding without sacrificing safety. That's what we're talking about today, Nursing Informatics Trends for Summer 2026, Top 20 Digital Health Tools to Improve Patient Care. By the time we're done, you'll know which tools are worth your energy, how to pilot them without adding chaos to your unit, and how to bring your team along without drowning them in vendor demos. This episode is for you, whether you're on night shift, in home health, or running a busy telemetry floor. Let's get started. Pause. Nurses revolutionize patient care. You've been there. It's 2 a.m. Your last med pass finished 15 minutes late. The charge nurse just paged you for a fall risk assessment on a new admit from the ED. You haven't even finished your progress notes. You glance at the EHR, another pop-up, complete pain reassessment. You want to scream, but you don't have the energy. So you click defer, knowing full well you'll forget until the surveyor catches it tomorrow. That's not just a documentation gap. That's a patient safety gap. And it happens every shift in hospitals across the country, not because nurses don't care, but because our tools aren't built for real nursing. The worst part? We're being asked to adopt new digital tools on top of an already broken workflow. Vendors promise these tools will save time and reduce errors. But too often, they don't. They add clicks. They crash. And worst of all, they make us feel like we're losing control of our own practice. In 2026, nursing informatics isn't just trendy, it's becoming a necessity. CMS's 2026 interoperability rules are tightening, AI-driven alerts are becoming standard in sepsis protocols, and ambient voice AI is starting to write discharge instructions while you round. But here's the catch, these tools only work if they fit your unit's rhythm. Not the vendor's demo. Not the IT department's timeline. Yours. Today, we're talking about the tools that are actually improving care, not just adding noise. We'll go deep on the top 20 tools making an impact this summer, how to evaluate them without getting bogged down, and how to pilot them safely on your unit. By the end, you'll have a clear path to bringing one of these tools to your team without burning out trying. Let's go. Pause. Here's what's really happening on the floor right now. Imagine it's a Tuesday afternoon. You've got a 75-year-old man admitted for COPD exacerbation. He's on 2 LNC, setting 90% on room air, but his last 3 SpO2 readings are trending down into the 80s while he's sleeping. You're supposed to catch that. But your EHR sepsis alert fired 6 hours ago, and you were in a code blue. You didn't see it until now. Not because you weren't busy, but because the alert buried itself under 37 other notifications. That's not an EHR problem. That's a system design problem. And it's costing lives. We've all seen it, the tool that was supposed to help us actually slows us down. The smart pump that won't infuse because it's waiting for a lab result that's already back. The telehealth platform that drops calls mid-shift because of a bandwidth hiccup. The AI sepsis model that fires alerts every time a patient's heart rate ticks up even when they're walking to the bathroom. These aren't hypotheticals. They're real scenarios nursing teams are living through every day. And they compound into burnout, errors, and patient harm. The problem isn't that we don't have enough tech. It's that we have too much tech that doesn't respect the reality of nursing workflow. So today, we're flipping the script. We're not here to drown you in another list of top 10 tools curated by a vendor. We're here to give you the real list, based on what's working in units like yours, with evidence you can trust. We're talking about tools that reduce charting drag, prevent falls, catch sepsis early, and even help you engage patients between visits. Tools that work with your shift, not against it. Let's dig into a story that might sound familiar. Pause. I want to take you back to one of the hardest shifts I ever worked. It was a Sunday night on a busy neuro floor. I had 4 patients, including a new stroke patient post-TPA, a post-op craniotomy with a Jackson-Pratt drain, and an elderly woman with a UTI and a history of falls. Around 20:45, my monitor alarm went off, fall risk score high. I checked my EHR, there was a pop-up, complete fall risk assessment. I clicked it, filled out 27 fields, and hit save. I was just about to check my meds when the alarm went off again. This time, it was the telemetry monitor, arrhythmia detected. Confirm rhythm. I ran to my patient's room, he was fine, just ambulating to the bathroom. But the system logged it as an event, and suddenly I was in a chart review at midnight because his telemetry showed irregular rhythm. Meanwhile, my stroke patient started showing signs of increased ICP. I had to page the neuro resident twice because the Epic SmartSet wasn't firing the critical care pathway. By the time I documented everything, it was 2:30. I missed my daughter's soccer game that Saturday. And I went home feeling like I'd failed. Not because I wasn't skilled, but because my tools weren't designed to support me, they were designed to audit me. That shift changed how I look at nursing informatics. Because I realized, the tools we use aren't just interfaces. They're part of our practice. And when they're not built with nurses at the center, they don't just add clicks, they add danger. Fast forward to 2026. Today, we have tools that learn from your unit's patterns. Tools that flag sepsis before it becomes a code. Tools that automate discharge instruction review and let you focus on education. Tools that integrate EHR data with wearables so you can spot dehydration in your heart failure patients before they decompensate. But here's the key, these tools only work if they're adopted by nurses, for nurses. That's not a given. In fact, studies from HAMSS 2025 show that 68% of nursing informatics projects fail because nursing voices aren't included in the design phase. So today, we're giving you the tools that nurses are actually using, to tools with proven ROI, tools that have cut medication errors by 22% in pilot units, tools that reduced fall rates by 15% when paired with real-time alerts. And we're going to show you how to bring them to your unit safely. This is your roadmap to modernizing without burning out. Let's break it down. Now, let's get into the 2026 nursing informatics landscape. This isn't just a list of shiny new gadgets, it's a snapshot of what's mature enough to pilot today. I've grouped them into 5 categories based on clinical impact and ease of adoption. Let's go. Category 1, AI and clinical decision support. 1. Sepsis prediction models with continuous monitoring, these aren't static alerts. Think ambient monitoring integrations like Epic's Deterioration Index or Cerner's Early Warning System, updated every 30 seconds. In 2025 trials, units using these saw sepsis bundle compliance jump from 62% to 88%. But here's the catch, you have to tune the thresholds to your unit. One hospital's sepsis model was firing 47 times a day because their patient population was sicker. They adjusted the systolic BP threshold from 90 to 85, and the false alarms dropped by 70%. 2. Fall risk ML engines, gone are the days of static fall risk scores. New models use EHR data, mobility sensors, and even sleep patterns to predict falls hours before they happen. Some units in New York are piloting wearable ankle monitors that vibrate when a patient stands unsafely, giving you 90 seconds to intervene. 3. Medication reconciliation AI, tools like Talix or MedAware integrate with your EHR to flag high-risk meds before you administer them. In one study, these cut wrong dose errors by 19%. But they only work if your pharmacy data is clean, so get your pharmacist involved early. For ambient voice AI for discharge instructions, imagine rounding with your patient and a voice assistant transcribes your conversation, drafts the discharge summary, and sends it to the patient portal, all while you're still at the bedside. Epic's latest ambient AI does exactly that. Early adopters report 40% faster discharge documentation. Category 2, interoperability and EHR enhancements. 5. Smart EHR dashboards with role-based views, not all EHRs are built equal. Some now let you customize dashboards based on your role. Night shift? Your dashboard shows pending meds, telemetry trends, and pending orders, no more scrolling through 17 tabs. 6. Automated patient education libraries. Tools like HealthWise or WellFrame integrate with the EHR to deliver patient education based on their diagnosis. No more handing out a generic pamphlet, your CHF patient gets a video tailored to their ejection fraction. 7. Interoperable infusion pump integration. Smart pumps like Alaris IQ or Baxter Infusion now sync with EHRs to verify dose, rate, and patient ID in real time. This isn't new, but 2026 interoperability rules mean they have to talk to the EHR. Units using this have seen medication error rates drop by 30%. 8. Telehealth First EHR templates. With CMS expanding telehealth reimbursement, EHRs now have dedicated templates for virtual visits. This isn't just for remote nurses. Acute care floors are using telehealth for rapid consults without paging specialists. Category 3, Remote Monitoring and Wearables. 9. Bluetooth-enabled vital sign monitors. Tools like Current Health or Bioformus let you monitor post-op patients at home. Your patient's pulse ox, BP, and weight data streams into your EHR dashboard. Early pilots in ortho units reduced readmissions by 12%. 10. Continuous glucose monitoring, CGM, integration. Diabetic patients on CGMs like Dexcom can share real-time glucose data with your EHR. Some hospitals now auto-trigger insulin protocols based on trends, no more waiting for finger sticks. 11. Wearable hydration sensors. Dehydration is a silent killer in older adults. New wristbands like Afro use bioimpedance to track fluid status. One SNF in Florida cut UTIs by 28% by catching dehydration early. 12. Fall detection wearables. Devices like Apple Watch with fall detection or dedicated fall wearables like Apple Seva send alerts to the nurse's phone when a patient falls. Units using these have reduced time to response from 4 minutes to 90 seconds. Category 4, Patient Engagement and Education. 13. AI-powered chatbots for discharge questions. Tools like Ada Health or Buoy let patients ask questions post-discharge. Some hospitals embed these in the patient portal, reducing call volume to the nurse triage line by 35%. 14. Gamified medication adherence apps. Apps like Mango Health or Pildrill turn med adherence into a game. Patients earn points for taking meds on time, and you get real-time alerts if they miss a dose. 15. Customized discharge video libraries. Instead of a stack of papers, some hospitals are using tools like Emmy Solutions to send personalized discharge videos to patients' phones. Studies show this improves adherence by 25%. 16. Family communication apps. Tools like MyDirectives or Twistle let families stay updated on their loved one's status without calling you. One ICU unit cut family interruptions by 40% using this. Category 5, Data Analytics and Quality Improvement. 17. Nursing-specific dashboards. Tools like ClickSense Nprint or Tableau dashboards built for nurses crunch EHR data to show trends like catheter-associated UTIs by shift, med pass delays, or fall rates by unit. One hospital used this to shift resources from days to nights and cut falls by 18%. 18. Predictive staffing models. AI like ShiftWise or Infor-HCM uses patient acuity, nurse skill mix, and historical census to predict staffing needs. Early users report 15% reduction in overtime. 19. Medication error trend analysis. Tools like Quantros or MedAptus analyze near-miss data to spot patterns. One unit found that 60% of their med errors happened during the 3 to 11 shift, so they moved their high-risk med pass to 2 to 4 p.m. 20. Patient satisfaction AI analysis. Platforms like PressGainy or NRC Health now use NLP to analyze free text comments. They flag phrases like "nurse seemed rushed" or "didn't explain my meds," so you can address issues before they hit a survey. Now, I know what you're thinking, Sarah, this sounds great, but my unit isn't ready for this chaos. Here's the truth. You don't need to adopt all 20 tomorrow. Start with one. Pick a tool based on your unit's biggest pain point. Is it falls? Try a fall risk ML engine. Is it sepsis codes? Start with an ambient sepsis alert. Is it documentation drag? Pilot an ambient voice AI for discharge instructions. Once you've picked your tool, here's how to bring it to your unit without burning out your team. Step 1. Start with a pilot question. Don't ask, "What tool should we buy?" Ask, can we reduce fall-related injuries by 15% in 90 days? That question guides your evaluation. It keeps the team focused on outcomes, not features. Step 2. Involve nurses in the demo. Don't let the IT department or vendor choose the tool for you. Invite a small group of nurses to the demo. Ask them, does this feel like it helps or hinders your workflow? If the answer isn't a resounding yes, walk away. Step 3. Start small, scale fast. Run a pilot with one patient cohort or one shift. If it works, expand. If it doesn't, iterate. The goal isn't perfection, it's progress. Step 4. Measure what matters. Track 3 things: time saved, error reduction, and patient engagement. If the tool doesn't improve these, it's not worth your unit's energy. Step 5. Celebrate the wins. When your pilot succeeds, announce it. When a patient tells you, I felt safer because the monitor caught my heart rate drop, share that. Positive reinforcement is the best change management tool you have. Pause. Let's be honest, some tools aren't ready for prime time. Here's what to watch out for. Overpromised AI. If a vendor claims their sepsis model has 99% accuracy, ask for peer-reviewed data. Even the best models have false positives, and in nursing, that means alarm fatigue. Poor interoperability. Tools that don't talk to your EHR are a headache. Avoid them unless they're part of a planned integration. Vendor lock-in. Some tools require proprietary hardware or software. Avoid contracts longer than 12 months unless you're certain the tool will deliver. Nurse disengagement. If nurses aren't involved in the pilot, the tool will fail. End of story. So here's where we are. You've got 20 tools. You've got a plan to pilot one. But let's talk about the bigger picture. Nursing informatics isn't just about tools, it's about control. Control over your documentation time. Control over patient safety. Control over your shift. The tools we've talked about today are designed to give you that control back. They're not here to replace you. They're here to support you. And when they work, they let you do what you got into nursing for, caring for patients. To the nurse who's been on the fence about tech, this is your moment. Change doesn't happen overnight. It happens one shift at a time. One tool at a time. One nurse at a time. You don't need to be an informatics expert to modernize your unit. You just need to be willing to try. Thank you for being here. For trusting your instincts. For putting patients first and for refusing to let technology get in the way of that. Thank you for watching Global Nurse Network today. You've just unlocked your modern nursing toolkit for summer 2026. If you're ready to put these tools into action, download the Top 20 Digital Health Tools Summer 2026 checklist at nurse.giftstribe.com. Print it. Share it with your team. And start your pilot this week. Don't forget to subscribe to Global Nurse Network for more deep dives on nursing innovation. Follow us on social at Nursegnn. We're on Instagram, TikTok, and LinkedIn, where we post daily tips and Q&A responses. Visit Nurse.
If you liked this video, smash that subscribe button and follow at Nursegnn across social media. See you in the next one.